Sympathetic is thoracolumbar T1 to L12. Parasympathetic is craniosacral 3, 7, 9, 10 and S2, S3, S4. And autonomic में sympathetic, parasympathetic, enteric. In sympathetic cholinergic, adrenergic. Parasympathetic में acetylcholine, acetylcholine. Sympathetic accepts sweat gland and piloerector smooth muscles, acetylcholine. Sweat gland and piloerector smooth muscles, acetylcholine. Sympathetic preganglionic neuron, lateral horn, preganglionic neuron T1 to L2, lateral horn of spinal cord leave through its ventral root. Postganglionic neuron in sympathetic chain ganglia. Postganglionic neuron in sympathetic chain ganglia extend to end organ. Postganglionic neuron in sympathetic chain ganglia extend to end organ. T1 to T5 हार्ट में, T1 to T5 हार्ट में, T6 to T11 GI में, T10 to T12 किडनी में, T10 to L2 लोअर यूरिनरी ट्रैक रिप्रोडक्टिव ऑर्गन में, ब्लड वेसल T1 to T5 यूरिनरी ब्लैडर में, T6 to L2 अपर पार्ट ऑफ बॉडी, T1 to T5, T6 to L2 लोअर पार्ट. Parasympathetic cranial nerve 10, control of heart, respiratory tract, GIT, S2, S4, bladder, lower part of bowel, reproductive organ. Spinal cord injury disrupts the descending sympathoexcitatory pathway. Spinal cord injury disrupts the sympathoexcitatory pathway from RVLM to spinal. Disruption of these cardiovascular pathway, initial sympathetic hypoactivity, alteration in the morphology, plastic changes in the spinal circuits, changes in peripheral sympathetic neurovascular responsiveness, low resting BP, loss of BP homeostasis, disturbed reflex control. With the time following spinal cord injury, loss of descending inhibitory pathway, sustained excitatory responses, extreme hypertension AD, generally seen in subacute and chronic stages. To evaluate autonomic functions, ISA FSI neurogenic shock is significant decrease in arterial BP from baseline in response to loss of baseline sympathetic tone, significant decrease in arterial BP, severe hypertension and bradycardia, SPP less than 90 and pulse rate less than 50 beats per minute. Management: chronotropes, inotropes, vasopressors. Cardiac dysrhythmia due to imbalance in heart control, intact parasympathetic control via vagus, impaired suprasternal control of sympathetic